Here's the Greens upper house candidate, Alison Xamon, explaining the policy to ABC Perth's Jeff Hutchison.
So once people are caught in the cycle of drug use, it's about how do we best get people out of that cycle, what is the best way to deal with that. And the evidence shows us that people who are caught in the grip of drug addiction are not best dealt with within our criminal justice system. We need to be diverting them into the health system, and that is what the Greens are advocating for, and that's what the Greens are calling for today.
Of course, you also have to further resource that health sector to be able to deal with those issues. So let's put out some parameters there. I am a 20-year-old party goer and I like taking party drugs. If I'm arrested for taking party drugs or I'm seen to take party drugs, what should happen to me?
Well, ideally, what you do is you divert people into the health system. One of the things that I'm really clear on is that, and the Greens are really clear on, is that we don't want to be encouraging people to take illicit drugs. It's not actually a good thing to do. But people do take drugs, and so we have to be realistic about this. And so if people are taking drugs, not dealing, but if people are taking drugs, then the one thing you want to do is make sure that people are at least able to take them, are taking them safely and not taking unnecessary risks with their lives.
So that's Alison Xamon, the Greens upper house candidate, explaining their new drug use policy for WA. I'm wondering what you think this afternoon. Is decriminalising personal drug use a good idea? If you'd like to get in touch on that this afternoon, you can give me a ring on 1300 545 222. You can also text in on 0448 922 604. In a moment, we will talk about the potential impact on the health system. But first, Dr. Stephen Bright is a senior lecturer in addiction at Edith Cowan University. Good afternoon.
Thanks for having me, Megan.
No worries at all. Now, do you agree that personal drug use should be seen as a health issue rather than a criminal one?
Absolutely. And so what they have done in Portugal is decriminalise the personal use of illicit substances. And what that's done is it's created a shift in the funding model so that money has been diverted away from the criminal justice system and put into the healthcare system, so that if somebody is caught with a small amount of drugs, then they go before a tribunal and it's determined whether they require some treatment or whether they're just a recreational user. If they are determined to require treatment, then the treatment services that Portugal has are significantly more sophisticated than what we have in Australia and in Western Australia, because that money that's been diverted from the criminal system has been put into the healthcare system.
Now, we heard Alison Xamon there talk about people who are caught in the grip of drug addiction needing help, but not everyone who takes drugs is addicted to drugs. So could we be sending people who aren't in need of help or don't want help into the health system?
No, so for those individuals, they're provided with harm reduction, and harm reduction is an evidence-based strategy for dealing with drugs. So for every dollar spent on harm reduction, it's been shown that harm reduction saves the overall economy $27 in healthcare costs, in criminal costs and so forth. So harm reduction involves things like pill testing and providing people with education around their substance use so that they are able to mitigate the harms associated with their substance use. An example of harm reduction would be drug checking or pill testing.
Is there a danger that this could normalise illegal drug use, though?
Well, from the evidence that we've seen internationally, this has not happened. And in countries that have introduced pill checking, there's been no increase in substance use. And in fact, where they've decriminalised drugs, they've seen a significant decrease in drug use. So Portugal's a good example of that, where they've seen a decrease in drug use rather than an increase in drug use compared to other European countries. In addition to that, pill testing provides an opportunity while the person's waiting to get the results back for a conversation to occur to discuss their drug use behaviours and provide them with information that may prevent them from experiencing harm by understanding what they already know about the particular drug that they think they're taking. And once they're provided with the information they're able to make an informed decision.
Do you think WA is ready for this kind of policy?
Absolutely. I think every state in Australia is ready for this policy, and I think the difficulty is what we've seen is inertia both at the federal level and the state level across Australia when it comes to pill testing. We have the equipment, we have teams that are ready to go to festivals and instigate this. The only thing that's holding it back is political blockages, and they're not being bipartisan support on evidence-based drug policy.
Okay, thank you so much for your time this afternoon. Dr. Stephen Bright there, a senior lecturer in addiction at Edith Cowan University, speaking about this new Green Party policy which has been announced today, which is basically calling for personal drug use to be decriminalised and treated as a health issue, not a legal one. Wondering what you think about this afternoon. Is decriminalising personal drug use a good idea? Would you like to see it happen in WA? If you'd like to get in touch about that, 1300 545 222 is the phone number. You can also text in on 0448 922 604. Now, the other side to this policy is the potential impact on the health system. Dan Hill is the he's the Health Services Union of WA Secretary, and he's with me. Got it out there in the end. Dan, how are you?
Well done, Megan. I'm well, thanks. And
now,
good afternoon to your listeners.
Thank you very much. Now, do you think the health system could cope if more people are put into it due to drug use?
Look, not on the current funding levels and staffing levels of the system. I mean, the Greens policy and what Dr. Bright has been talking to you about are all fine and good, but when it all boils down to it, it relies on dollars going into the health system, the rehabilitation system, to ensure that it's appropriately staffed to provide the services that the community requires.
Where would governments need to spend money and place resources to help cope with any increase in drug referrals?
Yeah, look, across the state, in all the regions, there are dedicated alcohol and drug service teams that are attached to the community mental health units at each of the hospitals. And they employ counsellors, psychologists, and others in providing those services. That's certainly where the money needs to be spent in those inpatient but also outpatient community-based services in the regions to ensure that there are appropriate staff there. At the moment, the staff are doing a great job under very trying circumstances and harsh conditions in some places, and without sufficient numbers of them. So, they need more and better qualified staff there as well to deal with what is a growing problem in our community, the illicit use of drugs.
Yeah, so just how much pressure is the health system under already due to drug addiction?
We're seeing it certainly in presentations in emergency departments. Quite clearly, the amount of presentations that are either drug and alcohol related is extremely high and increasing all the time. That's obviously an issue for the individuals presenting, but often results in violent outbursts and the like, and the safety of staff and other patients and other members of the community being put at risk. So that's happening not just in the metropolitan area in EDs, but certainly in the larger cities in the country, Bunbury, Geraldton and others, where they're experiencing that level of violence as well. So more money needs to go into that. Labor have got a plan for ED departments and mental health observation beds, which would include the drug. The government has its own plan on dealing with the meth epidemic, and the Greens now have come out with their plan. But whatever initiatives are put in place, it needs the dollars to go with it, not just as a once-off, but ongoing part of the recurrent funding of government to ensure that the services are provided.
If things like pill testing were brought in along with other harm minimisation strategies, could it actually lessen the load on the health system? Like we heard on the weekend about that festival in Melbourne where a whole bunch of people at a music festival, became critically ill after taking drugs. If there were pill testing facilities at festivals, could things like that actually, work in the health system's favour?
Oh, look, I think it certainly could, and any initiative such as that reduce the adverse effect of drugs in those situations and minimise harm is a good thing. But it's not, it's not the silver bullet. It's just one prong of a multi-pronged approach that needs to be taken to the issue. And I think, the various levels of government and in terms of agencies, police, health, the Mental Health Commission and others need to be talking more and talking to, the staff that are working on the front line, our paramedics, our frontline staff in the hospitals who are dealing with this day in, day out. They need to be engaged in the process of looking at initiatives and solutions to the problem.
Okay, thank you so much for your time this afternoon. Dan Hill there is the Health Services Union of WA Secretary. Now, we are speaking this afternoon about this new drug policy. It's been released today by the Greens. They are asking they want personal drug use to be treated as a health issue, not a legal one, for it to be decriminalised. Asking for your opinions on this afternoon. Do you agree that people who are found with small amounts of illicit drugs should be sent to the health system rather than the legal system? If you'd like to get in touch about that, you can give me a ring on 1300 545 222. You can also do this.
Be a part of the conversation. Text on 0448 922 604.
Samil from Parongarup is on the line. Afternoon, Samil.
Hey.
What do you think about this?
Personally, I think your Professor Addiction guy there nailed it. We've got to look at the evidence of where harm minimisation can actually have a hand. Because, hey, just think about it. We've had the 30, 40 years of war on drugs, and all it's done is brought more drugs and criminalised a whole class of people who are just, recreational. They're not criminals. But by penalising people, we've been punishing them for years, and there's more drug addiction. We've got to change tack, because what we've been doing, the definition of stupidity is doing the same thing over and over and expecting a different result. You punish people, they'll always come back and do the naughty thing, right? And at the moment, while drugs is naughty, it's a wonderful thing for them to be doing as a rebelliousness. You look at Amsterdam, and if you look at what's happened in Portugal, you'll see. Normalise it, the shine goes off it, and they've seen addiction rates drop dramatically in Portugal. It's just a no-brainer. You're looking at what's happening in Colorado at the moment with legalisation, Washington State. They're pulling in millions of dollars by decriminalising and taxing and regulating who can have it. They've seen crime rates plummet. Across the board in Colorado, they've had it now coming up 2-something years. The Greens, unfortunately, are the only ones with foresight to put up a positive drug action policy. There you go. That's me.
Thank you so much for sharing your opinion with us this afternoon. Really appreciate it. That's Samil from Parongarup. If you would like to get in touch about this, should we treat personal drug use as a health problem or a criminal one? That's my question for you this afternoon. 1300 545 222 is the phone number. You can also text in on 0448 922 604. This text says decriminalise, maybe, but somebody is still supplying these small amounts of drugs. And Fiona on the text line has said the Greens de-legalising personal drug use, typical, put it in the too hard basket and not getting to the crux of why people need to use. So no, I would not support it, and no, I will not be voting for the Green Party.